Let's talk about the COVID vaccine here because, as you know, as many as 28 million young children now eligible to get that shot. A group of CDC experts approved a lower dose of the Pfizer vaccine for children ages 5 to 11. And the CDC director, Dr. Michelle Walensky, signed off shortly thereafter. So here to break down what happens now, what parents need to know, former acting director of the CDC, also president and CEO of the Robert Wood Johnson Foundation, Dr. Richard Besser. Dr. Besser, good morning to you, sir.
Good morning.
Good morning. It's really hard to follow up the earring story, but it's great to be here.
Well, be sure to vote in that poll.
All right. Thank you, Dr. Besser. So, as you know, a lot of parents have been waiting for this. According to the CDC, since the start of the pandemic, more than 1.9 million COVID cases, more than 8,300 hospitalizations are children with COVID. 5 to 11. Everyone, should they be rushing out now to get that vaccine?
Well, I'm a general pediatrician, and, the news from yesterday just brings me incredible joy because now we have something that can help prevent future COVID infections in young children and help protect those around them. I watched the hearings yesterday very, very closely because I wanted to know, were the right questions being asked, were the right studies done so that I feel comfortable recommending this vaccine to my patients. And I came away feeling very convinced that these vaccines are safe. They're effective. There were no corners cut. And I'm ready to meet parents where they are to address their questions because I know there's a whole group of parents that want to be first in line to get vaccinated. There's another group of parents that want to wait and see. And I want to make sure that people get their questions answered.
Well, on that note, for the parents who are in the wait and see block, and that's a lot of folks, I think it's not a hard no. They just want to see what happens, whatever that means. People just they're just a little leery.
That's right. There's been so much information out there, misinformation out there, that the idea of wanting to wait and see, I understand that very, very fully. My takeaway from yesterday was that the data shows the vaccines are safe, they're effective. Even in children who've had COVID before, they saw a big boost in the level of protective factors. That gives me a lot of hope. And the idea that this will provide comfort, not just to parents, but also to children who've been under such incredible emotional stress as we've been keeping them on alert about being in contact with other people, about the fears of COVID. This is going to go a long way, I think, in terms of easing that as well.
So, Dr. Besser, now that it's been authorized, and there are vaccine mandates for other shots before a kid can get into school, do you think this will be rolled into those kind of mandates for schools across the country?
I don't think there's going to be a rush for that, and for a number of reasons. We know the best place for children right now is in school, learning in person, and it's also the safest place for so many children because of the measures that are in place. We see less transmission in schools than in communities, and given that there are a lot of parents who want to wait and see, there are about 30% of parents who want to be out there getting it right away, but that leaves a lot of parents who want to wait and see. You don't want to do anything that is going to lead to children not being allowed to be in school. I think over time that could change as the level of comfort changes with this vaccine. It'll also depend on what happens this winter with COVID. If we start to see big school outbreaks, then I wouldn't be surprised if schools say, you know what, we really believe that all children should be vaccinated so that we can keep everyone safe. But I don't think there are a lot of school districts that are going to rush to put in place a mandate. Some will, and we can learn from that, but I don't think there'll be many.
Dr. Besser, quickly, can we talk about vaccine equity? That certainly plays into this rollout as well. What do you think needs to be done to make sure that all families, even those in rural parts, underserved parts of the country, have access to this vaccine?
Yeah, there are a lot of working parents who don't get time off work to get their kids vaccinated. They're worried about that. Parents who are worried about cost. It's really important that in addition to providing this in clinics where parents can get their questions answered, that there are evening clinics, there's weekend clinics, that it's available in pharmacies so that parents can take their kids in at a time that's convenient for them, and you don't have parents having to decide between getting their kids vaccinated and earning a paycheck. That's not what we want to see, especially when we've seen such disparate impact with Black, Latino, Indigenous children having much more severe disease than you would expect. Very important that people can get this vaccine in ways that works for them.
Dr. Richard Besser, we'll leave it there. Thank you, doctor. Thanks as always, sir.
Thank you so much.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.